Hi guys.
Hi, I'm Dr. Abby.
And I'm Dr. Jeremy from Sprouting Health, Chiropractic and Kinesiology.
And we're going to talk about our latest blog, which is on managing back pain and pelvic pain in pregnancy. So a large majority, which is 50 to 70% of women, will experience back pain or pelvic pain in pregnancy, and it is actually medically expected that most women will experience it. However, in our experience, women don't actually have to suffer with it or have it affect their daily lives. So we just want to explore with you some of the reasons why it might be happening through pregnancy, so you actually understand why it's occurring for you or for your partner.
And give you some really good strategies to help that not occur.
Yeah. Yep.
I think females have to go through enough already without having to be in pain while you're pregnant.
Yeah.
At least for the duration of the pregnancy anyway, yeah.
And afterwards as well. So that's what we're here for. So some of the causes for back pain during pregnancy, and some of these causes are actually the same causes for postpartum as well. And that can actually be previous history of back pain. So if you have had back pain in the past, you are more likely to experience back pain or pelvic pain during pregnancy. Your hormonal changes. So there, as you know, if you are pregnant, there is a lot of hormonal changes and there's a lot of structural changes that also happen during pregnancy as bud grows. The postural shifts or the postural changes play a large role in back pain and pelvic pain, especially as bud takes up more space, leaving you very little room for the rest of your organs.
Absolutely, especially diaphragm breathing.
Yep. Yeah. And then daily habits, especially if you have a toddler at home. So constantly bending and squatting and lifting, and believe it or not, daily house chores can also cause a major issue for a lot of women who are pregnant and have back pain. Your sleep and your sleep position. So that is one thing as chiropractors we do go over with pregnant women to make sure that you are sleeping the best way possible to support your low back. And stress is a big one as well. So trying to get you to move more and limit your stress is a key thing, but Dr. Jeremy will go through that in a second. And hydration, electrolytes, and nutrition. So there's a few things that...
Wonderful.
Yeah.
So Dr. Abby's covered that pretty amazingly, I think. A couple of things that I could add to that is your relaxin peaks in the first trimester. And for those of you, you probably know what relaxin is, but some may not. It's a hormone that comes out that softens all your ligaments. And Dr. Abby just gave us some pretty awesome points there about that people that have been prone to back pain, well, it's going to be worse when you're pregnant because the relaxin kicks in and little issues are going to be exacerbated. So I like that point.
Watching this, or people who have partners who are postpartum, that relaxin can actually stay in your system. Medically, they don't say it can stay in your system for very long, but as chiropractors, we actually find that women can adjust very differently. So if you're experiencing back pain after giving birth, relaxin can also be a part that's playing an effect in that as well.
Absolutely. So what can we do to help? Well, we do lots of different techniques ranging from the physical, so to help your posture sit in a better way, to move your diaphragm open up so you can breathe easier. Make sure your pelvis is moving to help manage or prevent the symphysis pubic type pains that are really common in pregnancy, low back pain. We'll give you different advice around movement, bending, lifting, some specific exercises we can do. And then we can start to look at other things like your chemical system, how you're going to be best supported with nutrition, vitamins and minerals as you're growing your beautiful bubba. And then also you alluded to some stress reduction techniques, which we also go into here. Because we're kinesiologists, we love looking at your physical, chemical and mental emotional aspect of your health. Lots more things. I think that's a pretty good summary of what we do, but we'd love to see you in here. If you're pregnant or if you know someone who's pregnant, tell them they don't have to put up with that pain. And as one little bonus, there is some research. It would be always nice to have more research on this, but there's some cool research about pregnancy times of the labour. So labour times relating to chiropractic care, and I think there's some basic stuff about helping manage recovery as well.
Yeah.
Do you want to add anything?
The only thing I would add, if you're a pregnant woman who is struggling with her sleep, check out Yoga Nidra or NSDR, which is non-sleep deep rest, because that can help your pain and your stress levels a lot. So have a look at that on YouTube.
Thank you guys.
Thank you.